I'm Joe Halco, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. The holiday season is a time of joy and giving, as well as making resolutions to better ourselves in the coming year. However, it can also be a time of increased anxiety for many, and may even cause some people to become depressed. This month's episode is an encore presentation of mental health first aid. Since this episode first aired earlier this year, an exciting development has occurred. Vermont Care Partners was awarded a 3-year mental health awareness training grant named Community First from the Substance Abuse and Mental Health Services Administration. This is a statewide initiative which in our region will allow NCSS to provide no-cost youth and adult mental health first aid training to community members. Studies show that training in mental health first aid builds confidence in helping an individual experiencing a mental health challenge, reduces negative or distancing attitudes towards individuals with mental illnesses, and increases mental health literacy by being able to identify, understanding and respond to signs of mental health and substance use disorders. To gain a greater understanding of the value that mental health first aid offers its participants, let's go to our encore presentation of my interview with Lance Metayer, team leader of NCSS School-Based Clinical Services, and our discussion about mental health first aid training. So let's start with, what is the role of mental health first aid?
Sure. So mental health first aid is an 8-hour training program. It's a public education program that we provide to our community, which really teaches the signs and symptoms. So it teaches community members how to recognize the signs and symptoms of a mental illness or mental health challenge. But beyond that, it actually teaches how to intervene. So we teach what to do and what to say, and we actually practice during the training different scenarios about how we may approach someone and how we may support.
And what are the goals and outcomes overall of the training?
So there are a couple of different goals for the training. The first is that when first aiders leave the training, that they actually have the skills and knowledge to be able to support someone through a mental health crisis or a mental health challenge. So we talk a lot about resources that are available within the community. So we talk about NCSS services, but also private services as well that are available to our community members. So another really big outcome is that we talk a lot about suicide and suicide assessment during the training as well. So through taking the training, you won't be trained to actually assess someone for a risk of suicide. So we always encourage and ask that if someone potentially is suicidal, that they're referred back to professional support. But you will learn a lot of the risk factors and warning signs to suicide, and you'll learn how to support someone who may be suicidal throughout the training.
Sorry.
Yeah. So we also talk a lot about stigma as well. So I think the mental health first aid training is a really good opportunity for us to think about how mental health impacts us as individuals, but also community members. And we really address and talk about the stigma that is out there, and really the bias sometimes against people living with mental health challenges.
Well, and the interesting thing is that, the statistic that I talked about in the introduction is the fact that I think a lot of times people think it's the we of the people with physical ailments, whether it's diabetes or cardiac arrest or whatever the case may be, versus the they of something that is brain-based, which is kind of an interesting dynamic when you think about it, because the last time anybody checked, of course, the brain is an organ of the body, just like the heart and the liver and the kidneys, etc. And it's very complex, as we all know. And there's a myriad of things that in the circuitry that can go awry. So I always find it rather interesting when it's kind of the we, they, the physical versus the mental, with, in essence, they're both combined. If you're going to treat the whole individual and what they're dealing with in life, you really have to treat both the physical and the mental in combination to help someone to, make it through certain circumstances. I know a lot of times we talk about the person who may have just had knee surgery, as an example, and maybe they were a runner their entire life. And the doctor comes in and says the good news is that because of circumstances, you're going to heal perfectly fine. But the bad news is because of your particular age and maybe some other circumstances, you're not going to be able to run anymore. Now, maybe the person's been a runner their entire life. They have two paths they can take. One is to accept that and come up maybe with a walking plan or some other sort of plan. Or the other is they can get deeply depressed and say, I'm not going to be able to run anymore. So I guess what I'm saying, that's maybe a rather simplistic way of looking at how the physical and the mental really do combine in someone's well-being as an individual. And you mentioned about mental health first aid does not mean somebody is going to become a therapist.
Right.
I mean, just like regular first aid doesn't mean that somebody becomes a doctor and they go out and diagnose a situation.
Absolutely.
So what you're saying is very much aligned, I think, in the same way.
Absolutely. And I really equate the physical first aid, CPR, that we take, and a lot of people are actually trained in, to mental health first aid. So in CPR first aid, we're not taught how to ventilate someone in the field, right? We're taught how to assess the scene and safety and provide just immediate care and support for a person. So it's pretty much the same with mental health first aid as well. So we're not providing diagnosis, we're not providing cognitive behavioral therapy, and we're not providing even a suicide assessment, to say that this person is safe, even though they're talking about suicide. Really, we're just learning the basic steps of how to support someone through a mental health challenge or crisis and refer them to appropriate professional supports.
No different than if somebody that you're working with today, as you go into their office, they say, boy, I'm not feeling quite right. I'm not sure what it is, but I have a pain in my stomach or side or whatever. And you may be encouraging and say, perhaps you ought to go to your primary care doctor.
Right.
Same scenario, same situation is really what you're talking about.
Absolutely. Yeah. And so, the fact is that, a lot of us are trained in medical first aid or CPR, but we are actually much more likely to encounter someone experiencing a mental health challenge or mental health crisis versus a cardiac emergency. So really our mission is to get this training out to our community because mental health challenges or crises are very prevalent in our population, and we need to talk about that, and we need to know how to address it and how to support someone, or even potentially ourselves, if we're in that situation.
And you've already mentioned stigma, and I think because of the stigma, of course, so many people, the last thing they would want to do is deal with anything that has to do with mental health. Although, as you're going to show, through this training, people can at least become more understanding of certain types of behaviors and circumstances that people.
Absolutely. Yeah, sometimes there's guilt or shame associated with having a mental health challenge or a mental illness. And I think that the community, we're working hard to change, but still, there is that stigma in the community, and that prevents people from accessing care. It prevents people from talking about their stories and seeking support and treatment. I kind of think about if I had a neighbor that broke their leg maybe or was in a car accident and was immobile, I think about the support that I would provide to them. I would probably go to their house if it was the wintertime, maybe help them shovel snow. If they needed a ramp built, I would help them to do that. And then I think about maybe a neighbor living with depression, and I think about, are we as likely to go over and talk to them or provide them with support or to help them through their recovery process? And I think that sometimes we aren't as likely to reach out with people who are struggling with a mental health challenge versus a physical health challenge. So this is something that we talk about in the training, and my hope is that people are really shifting the way that they think about mental illness and really demystifying it and making it a little bit less scary. And we also talk about recovery as well, which is something that a lot of people don't understand, that there's this concept of recovery with mental health challenges and mental illness, just like with physical health, right? The person with a broken leg, their leg won't be broken forever. And for a person living with anxiety or depression, there's a great potential that they won't be living with anxiety or depression forever. With either self-help that they provide to themselves or potentially professional help as well. So they can reach a place of wellness and recovery.
So, we look at some of the disorders like depression, anxiety, substance abuse. They've always been very prevalent. How does the training address these areas?
Sure. So each of those different disorders, as long as, or with psychosis as well, we actually talk about in the mental health first aid training. So we talk about signs and symptoms really specific to each disorder, risk factors, and also protective factors as well. So protective factors are the things that can actually prevent a disorder from developing or increase the chance for recovery. So we talk about those kind of specific points for each disorder, and then we actually learn, it's called the ALGE action plan, but it's an action plan that will support the first aider in providing intervention with someone who may be impacted by any of the disorders that you just mentioned.
Now, I know you touched on suicide a little bit earlier, but let's talk about suicide and non-suicidal self-injury and the importance of these being included in the training, especially in today's world.
Right. So we talk about suicide very directly in this training because I think it's important to. I think suicide is something that impacts a lot of us in the community, either being a suicide survivor or someone who's impacted by the loss of a loved one due to suicide, a death by suicide. So we take that very seriously, and we teach skills to recognize the warning signs for suicide, and we actually talk about and actually practice how to approach someone who is suicidal and engage them in conversation about their safety and their well-being. And then we teach and practice the steps to actually link them to professional care and support to make sure that they're safe.
And I think, that is so critical today because stigma is one thing, but I think the minute you toss suicide into discussion, it becomes even, for a lot of people, more stigmatizing to go down that path. And, many times, as you've said, it's a matter of being able to identify that somebody's really struggling and trying to get them to seek the help they need so that they can try to figure out why they feel that way and, what can they do to modify their outlook.
Right. Yeah, and I think that it's a hard conversation and it's a scary conversation, but it's a conversation that we need to have in our community. We talk about the importance of asking the question. So talking about suicide very directly with someone, and research has shown that is a huge preventative factor and actually a great step to actually potentially save someone's life.
Now, evidence-based results to date have shown that participants themselves of the training have improved their mental health. Does this course also teach self-care?
Yeah, so that's actually a really interesting fact, is that if you take the course yourself, there's been evidence that has shown that you will have yourself improved mental health, which I think is interesting. And maybe part of the reason of that is because we look at mental health a different way after we take the course, and it hopefully is a bit more accepted. Yeah, so your next question, Joe.
No, that's okay. Yeah. That's okay. Now, the other thing that's rather interesting, I think, from our perspective, is the fact that back in 2010, we began offering mental health first aid to the community and to organizations. But several years ago, we then also launched the youth mental health first aid training as well. Could you elaborate on the success of that program as well? Sure. And how it's impacted the community locally? Yeah,
so we've had a grant called Aware Vermont for just about the last 3 years. So this grant has actually developed a statewide infrastructure to provide youth mental health first aid training, which really is focused on intervention in the youth population. So young people between the ages of 12 and 18. So through that grant, we have a network of about 36 youth mental health first aid instructors really housed throughout the DA system, the designated agency system, but also with a lot of really great community partners as well. And through our work, we've actually trained over 2,200 Vermonters to be youth mental health first aiders. In our saturation rate, this is how we measure our effectiveness,
Yes.
is that we actually have one youth mental health first aider for every 21 youth living within the state of Vermont. So I think
That's
we're pretty
incredible.
proud of that. Yeah, and really the goal of the grant is to, in our work, is to increase early intervention for youth so that they're not struggling with an undiagnosed or untreated mental health challenge or mental illness.
Well, I think another thing that many times is misunderstood is the fact that a lot of these mental health disorders, the onset could be as early as, say, age 14. So it isn't as if all of these wait until someone's an adult. So I think when you combine that with what you're saying, it's really the perfect timing to get young people engaged in this topical matter. So hopefully it can help them curtail some of these disorders at a much earlier stage.
Absolutely. And actually, an interesting fact is that for half of people who are living with a mental illness in their lifetime, they first see the signs and symptoms before the age of 14. So we're talking about a very young population to intervene with, which is why early intervention is so important.
And, when we again talk about the amount of individuals who will seek help over their lifetime, there's a large percentage of people that are struggling with a mental health disorder that never seek treatment.
Right.
And I think the second part, if you could speak to, is the fact that even those that do seek treatment many times wait 5 or 10 years. Now,
Right.
would you do that again with a physical ailment? Of course, the answer is no.
Sure.
So I think that's paramount and goes back to stigma as well.
Right. So I think a pretty alarming statistic for me is that the median time that someone waits when they first recognize the signs and symptoms of mental health challenge, the median time is 10 years before they're receiving treatment or intervention. And then, after that, only 41% of individuals actually with a diagnosed mental health disorder, actually receive treatment in a given year. So I think that, we really want to bring that 10-year number down so that people are receiving treatment a lot earlier.
Well, because it's like anything else. The longer that you wait, perhaps the more severe it becomes,
Absolutely.
which then, and I know everyone's different as far as what their plan would be, but it would then take perhaps a longer period of time with treatment to then overcome that particular disorder versus, as you say, if we could have the opportunity to see them a lot earlier.
Absolutely. Right. And I think that there are a lot of different factors that go into that 10-year time. Part of it is because people aren't educated to recognize the signs and symptoms of mental illness because it's something that we don't necessarily talk about in our community. I think another reason is back to that piece around stigma that we talked about earlier. Even when someone does recognize that they're experiencing a challenge, we don't talk about it because there's sometimes guilt or shame associated with that. So that can prevent us from seeking access to care.
And this gets back to this month being Mental Health Awareness Month and the fact that we really need to celebrate the fact of being able to openly talk about any and all mental health disorders and be able to sit around a table like you and I are and have people talk about these things freely as opposed to, as you say, having all that guilt or pent up guilt. Because there really is no need to when they can really start on a road and a path a lot earlier.
Absolutely. Yeah, and I think that's the goal of our programming and the message that we really want to get out to the community.
I'm sorry. So, I know we're talking a bit here today about stigma, but I really do believe that NCSS as an organization, has a role in trying to break down that stigma so that people truly can start to talk about it. Because as I've always said, if we don't do it, who else is going to do it? It will continue to contain itself. But I think from what you've said today, whether it's through the adult mental health first aid programming or the children's youth mental health, I should say the youth mental health first aid training, that these are opportunities for people to get the understanding and the knowledge of what these early warning signs are, and then to try to help someone. I think one of the big things is when you talk about trying to help someone, it doesn't mean that they do it in front of a crowd or whatever. We're really talking about one-on-one discussions where it's very private. People can just talk to those that are the closest to them and talk about what they're seeing that might be differences in behavior.
Right, right. And we want to do that in a really genuine and caring way where we're not confronting or placing blame or shaming the person, right? Or we're talking about all of the things that are wrong, right? Because we know that that's not going to increase someone's ability or willingness to accept care and to really hear what we're trying to say.
So one of the things I want to ask you about before we leave today is, I know you had an incredible youth mental health first aid training of the entire staff at MVU. If you could just speak a little bit about that, because that was so impactful when that took place. And I think you had gotten a lot of comments that perhaps you didn't even think you would get from staff up, how wonderful they thought the training was.
Yeah, so we've actually trained about 800 educators throughout Franklin and Grand Isle County. MVU is one of the first schools that we did an entire staff training, so that was very exciting. But I just think that this speaks to schools, schools' commitment to mental health and to the youth that they serve throughout Franklin and Grand Isle County, but also to the community's commitment to this program. I've really have met a lot of very engaged and passionate community members who are really actively working. This is their mission, as long as, along with me, this is my mission as well, to really be addressing mental health in our community and stigma in our community. So it's really encouraging to see. It's a really great dialogue to have.
Well, I'll tell you, the work that you're doing on both the adult front and the youth front is terrific, Lance. And, I'm sure I speak on behalf of a lot of people locally that you have trained, that they're very thankful that they had the opportunity to have you come in and do the training. And secondarily, I think it's something that, is there anything you'd like to say to those who haven't been trained as to, what they can expect or anything you'd like to say as far as why everybody needs to be trained in this?
Absolutely. I mean, mental health impacts all of us. If it doesn't impact us directly with our own mental health, we know someone who either has or is currently struggling with a mental health challenge or diagnosable mental illness. We need to know how to respond in the best ways to support them. So I would absolutely advocate for anyone and everyone to take this training, even if you think that it doesn't directly apply to you. I've had a lot of people sign up for the training and not really be sure about how it would apply to them. And then at the end of the training, they have really seen things differently, right? They've seen how mental health impacts all of us and the role that they can have in someone's life.
And if someone's interested, how do they get in touch with you?
Sure. So a great way to get in touch with us is call NCSS directly at 524-6554. And they can ask for me, and so Lance, and they can be directed to me, and I can help set up a training either in a community or within an agency as well.
I want to thank my guest, Lance Metayer, for sharing his insights on the benefits that mental health first aid provides in understanding the early warning signs of mental health disorders. To inquire about an upcoming training or to schedule a no-cost training for your organization, contact Lance Metayer at either 802-582-8039 or at lancemetayer@ncssinc.org. Now, before we go, it's time for the NCSS Factoid of the Month. Even though the month of September serves as Suicide Prevention Awareness Month, at NCSS, we want to make certain that this topic is in the forefront 24 hours a day, 7 days a week, and 365 days a year. Among the many specialty services made available to the community, NCSS offers prevention programs by facilitating mental health first aid and youth mental health first aid trainings. In addition, we have adolescent services, community services, outpatient, crisis, and mobile crisis available in your time of need. NCSS provides confidential services and programs to residents struggling with suicidal thoughts. NCSS is here for you with services to assist if you or someone you know is struggling with suicidal thoughts. You can call our crisis line at 524-6554. NCSS, you may not know us until you need us. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about mental health first aid and all of our programs and services by visiting ncssinc.org. I'm Joe Halco, and I'll be back next month with another episode of NCSS Here for You.